Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Samir. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. I'm very sorry to hear about that, Mr. Samir, and I understand your worries. But I appreciate that you took the first step and you came to clinic and you are concerned about your health. So I really appreciate that. But Mr. Samir, before I come to the management part, I need to ask you a few questions. Is it okay with you? Thanks for your cooperation, Mr. Samir. So can you tell me um, since how long you are suffering from these symptoms? Mm-hmm. Okay. Do you know what is your waist circumference? Mm-hmm. Have you noticed that it has increased? Mm-hmm. Have you noticed that your weight has increased? Mm-hmm. All right. Do you feel lethargy most of the time? All right. Mr. Sami, have you noticed this, any vision changes? If there is any blood vision? Mm-hmm. Do you have pain or numbness in hands, in feet? Mm-hmm. If there is any, you have to drink frequently. Is your thirst increased? Okay. Have you noticed increase in your urinary frequency? Mm-hmm. Okay. Do you have have you experienced any short of breath? If there is any chest pain? Mm-hmm. How about your bowel habits, Mr. Samir? Okay. Have you noticed any change in your voice? Mm-hmm. Okay. What kind of food you take typically? Mm-hmm. And along with that, do you do exercise on daily basis? Okay. Mm-hmm. Okay, Mr. Sami, do you have any tummy pain? Radiating to back at the tip of shoulder? Mm-hmm. Okay. Mr. Samir, I'll ask a few personal questions to better understand. Is it okay with you? Thanks for your cooperation. So, Mr. Samir, if you are married, and do you have children? Okay. And what do you do for a living? Okay. How's everything at workplace? And how's everything at home? How's your sleep, Mr. Samir? Okay. And do you smoke? How much cigarettes per day, Mr. Samir? Have you ever tried to quit this habit? All right, I really appreciate that, and we'll talk detail in next appointment. How it sounds to you, Mr. Samir? Do you drink alcohol? Okay, Mr. Samir, do you have any high blood pressure, high blood sugar, any neck gland problem? All right. So, Mr. Samir, if any immediate family member suffering from a heart-related problem, high blood sugar, high blood pressure, and how about their weight? Okay. All right, Mr. Samir, if you are taking any medication so far, prescribed by doctor over the counter? Have you experienced any joint pain which lasts more than 1 hour in the morning? Okay. Any pain at the end of the day? All right, Mr. Samir. So in order to better understand, I need to examine you. Is it okay with you? Thanks for your cooperation. And could you please come on the couch? Thank you. And then I'll sanitize my hands and let them dry. And then I'll start from general physical examination. I'll look at his face, and if there is a facial or periorbital edema, if there is any cyanosis, any rashes, any spider nevis, any bulgings, to exclude any lipoma. And then I'll ask, I'll look up, I'll look down, and show me a tip of your tongue. And then I'll examine his neck from front, and ask patient if there is any tenderness, and from back, and ask patient to swallow. And then I'll check his pulse and his blood pressure, and then I'll check if the neck, if there is any darkening of neck, and then I'll check his abdomen for any splenomegaly, and if there is any ascites, and then I'll auscultate his heart, aortic, pulmonary, tricuspid, and mitral region, and his chest, apical basis, and right middle lobe. And then I'll check his shins for edema, and feet for if there is any ulcer, any deformity. Thanks for your cooperation, Mr. Samir. And then I'll check his waist circumference. Thanks for your cooperation, Mr. Samir, and you can have your seat. So, Mr. Samir, have you undergone any investigation so far other than this? All right. Okay, Mr. Samir, the history you have shared, and question I have asked, and examination I have performed, and investigations, I will state most probably you are suffering from condition what we call in a medical terminology is metabolic syndrome. Okay, so I'll advise you some non-pharmacological and pharmacological treatments. Is it okay with you, Mr. Samir? Okay, so Mr. Samir, I strongly recommend you to, lose weight, okay, some lifestyle modification. I'll strongly recommend you to lose weight, okay, 5 to 10% of body weight reduction, okay. Yes, and I'll strongly recommend you to stop smoking, okay, and I'll encourage you to increase saturated carbohydrates and lower fatty foods, okay, and focus on whole grains, fruits, and vegetables, okay. And I'll encourage you to decrease salt, okay, eat low salt diet, okay. And I'll encourage you to do exercise, okay. I'll advise you to do a brisk walk for 30 minutes for 5 days in a week, okay. And I'll encourage you to sleep for sleep hygiene, okay, and sleep for 7 to 8 hours per night. Okay, and don't sleep immediately after having meal, okay, and there should be gap of 3 hours, okay. And I encourage you to do a yoga or medication, okay, and deep breathing exercises, okay. And can you do it, Mr. Samir? All right, Mr. Samir, and along with that, prescribe me some medication, okay. Prescribing tablet metformin, okay, 500 mg OD, okay, for 14 days, okay, and then I will increase dose to BD, okay, and will reassess, okay. It will improve your insulin sensitivity, okay, and along with that, yes, and let me clear that Mr. Samir, you can have a metabolic test after taking this medication. Okay, you need not to be worried. Okay, and along with that, I'm prescribing tablet simvastatin 20 mg. Okay, you have to take it at night. Okay. It will lower your cholesterol levels. Okay, and along with that, as your blood pressure is high. Okay, so I'm prescribing you tablet Framipral 1.2 mg. Okay, you have to take it once a day for blood pressure. It will control your blood pressure. All right. And Mr. Samir, I'll strongly recommend you to follow this instruction and non-pharmacological, okay, so that you can prevent complications like heart-related cardiovascular diseases, okay, and type 2 diabetes, okay, and renal problems, okay, and liver problem, okay, and mental issues as well, okay. If it makes sense to you, Mr. Samir. If there is anything